That was a bit too much information. So let's talk about the important stuff today. And when Richard and Catherine asked me to speak about the power of macronutrients and micronutrients, I thought, gee, that is an interesting topic. And I'm from the U of A, where we have profs and a faculty of nutrition. They have whole courses in macronutrients and micronutrients. I have some disclosures. None are really relevant to the discussion today. And I've defined my learning objectives, and you have a copy of those. But what I'd like to do is I would like to challenge this group by asking you to ask yourself a question. And it really relates to what Des was talking about. How can we better meet patient expectations and needs as it relates to optimizing health through the power of macronutrients and micronutrients? So really what we're here to ask ourselves today as health professionals is how can we use food to improve health? My own bias is that by beginning with an understanding of how nutrients, macronutrients and micronutrients that we want to optimize relate to food, and how food choices and dietary patterns relate to wellness and illness is a great place to start. So you guys are in the right location. Can I just do a quick poll? How many nurses in the audience? Dietitians? Are there any physicians in the audience? Great. So we've got a diversity of health professionals, all of whom have different roles as we approach patient care. Some are in health promotion, disease prevention. Some are in work in the area of treating people with illness. We've got health professionals who have expertise in nutrients. So in fact, for many of you, this will not be new news. I thought I'd start with a definition, because if we're actually talking about nutrients, we have to be on the same page. You go to the dictionary, because this isn't in nutrition textbooks, and a macronutrient is described as an essential nutrient that's required in a large amount. Protein, carbohydrate, fat, water. Those are big nutrients. You need a lot of them to meet your recommended nutrient intake. Conversely, micronutrients are essential components of diet without which you'd have abnormal physiology or function that are required in minute amounts. And I'm a lumper. I like to lump things. Micronutrients include electrolytes, vitamins, minerals, trace elements. A lot of mixture in that soup. So let's just talk a little bit about these, because the intent today is to give you an overview of how nutrients relate to food and how food relates to illness. So protein, the World Health Organization says people in the world need 0.6 grams per kilo of protein per day. In North America, protein intakes typically far exceed that, and we broach 1.5 to 2 grams per kilo. I see a lot of women in the audience who cook a lot of meals and sling a lot of hash for their families. So where'd you get protein? You get it from meat sources, milk sources, grains, occasionally legumes, etc. Carbohydrates, really we strive to provide 50% of our calories. That's what the food guide identifies as energy sources. They're 4 calories per gram. And if you look at what foods contain carbohydrates, things should pop to your mind. Bread, juices, beverages, milk is a source of carbohydrate. Think lactose, fruits and vegetables. Fat requirements, 25% of energy. If you're on Atkins diet, it's higher than that. You actually only need 4% of your calories from essential fatty acids to prevent essential fatty acid deficiency. So you don't actually need too much fat in your diet. What are the sources? Think of the food guide, meats and alternatives, and milk products, because we're encouraged to choose low-fat milk products. But actually, think about where you get canola from. That's a grain product. So in fact, in grains, there is some fat. We never think of water as a required nutrient, but I do. I'm a gastroenterologist. I deal with a lot of intestinal failure and insensible losses, so I'm always thinking about volume. But from a population health perspective, where do we get our water? We get it from fructose-sweetened beverages and those super cappuccinos you get from Second Cup. So those are macronutrients. Dietary fiber deserves a special discussion, particularly because this is a digestive health discussion. And the average daily intake really is only about a third of what's required based on Canadian Community Health Survey data from 2004. Canadians get about 10 to 12 grams of fiber a day. The recommended nutrient intake is 25 grams per day. Sources, whole grains, legumes, cereals. Fruit and vegetables also contain fiber, but in lesser amounts, and that's a really common misconception amongst the public, because when I say, gee, how much fiber you get in your diet for your constipation, they say, well, I eat an apple a day. Well, an apple only has 2 grams of fiber. There's not a lot of fiber in fruit and vegetables necessarily. I also have a lot of patients who say, I take my Metamucil. Can I take the capsules, doctor? They're 250 milligrams. Well, you have to take 40 capsules to have as much Metamucil as you get in 1 heaping tablespoon, and that's 10 grams. So if you're desperate for your fiber, that's a consideration. Not all fiber is the same. So whole grains actually contain germ, endosperm, and bran, in contrast to highly refined grains that you get in a baguette that really taste good, because those whole grains also contain vitamins, minerals, and phytochemicals in addition to these important fiber-containing components. So those are macronutrients. What about micronutrients? It is a whole soup and mixture of nuts. So electrolytes, the one I always think of that are really relevant for health, include potassium and sodium. We'll talk a little bit about sodium. Vitamins A, B, C, D, E, K. The sources depend on the vitamin, the requirements depend on the vitamin. Mineral considerations, calcium, magnesium, iron for your GI health, phosphorus, these are minerals. Sources depend on the particular nutrient, but milk is actually a really good source of calcium, phosphorus, and magnesium. Red meat, good source of iron, for instance. Dark green leafy vegetables. What about trace elements? Once again, sources depend upon the trace elements. What about other things? One of my micronutrient fellows, I did a lecture for Nutrition 510 last week, and his favorite micronutrient is choline. I didn't actually know that it had the status of micronutrients, but there are other nutrients out there that aren't in the public paradigm. There are a lot of macronutrients and micronutrients. Can we as a group of health professionals think about optimizing macronutrient or micronutrients in our diet? I actually would suggest that we start by thinking about how we eat and what we eat and what our role as health professionals are in describing this. The Canada Food Guide for Healthy Eating takes a lot of heat, but for health professionals it's only a tool. Your kids in K-12 get this. They stick it up on the fridge, they know how many F's and B's and how many grains they're supposed to eat. And it's simply a tool that describes a pattern of intake related to fruits and vegetables, grains and alternatives, milk and milk products, meat and alternatives, and it has a recommended range of intake based on age and area of the life cycle. It's not a guide that we interpret for application in people, for instance, with illness. One of the unfortunate problems is that health professionals remember that they learned this in K-12, but they don't use it as a guide or a teaching tool, because that is all it is. It is a tool for education purposes. And it was based on 2 key reports. It was most recently updated in 2007, and Dr. Hassan Hutchinson is going to talk to us a little bit. They're reviewing it apparently at this time. And the food guide was developed based on convincing evidence that increased intake of fruit and vegetables was associated with reduction in cardiovascular and cancer risk. That increased whole grain consumption was associated with a reduction in cardiovascular risk and potentially colon cancer. We'll look at that a little bit further. And that increased intake of fish and omega-3 fatty acids was associated with a reduction in cardiovascular risk. And there's a question. And in fact, in 2007, they suggested a review, and there was consistency for findings with fruit, vegetables, and whole grains. Those are good things, not very controversial. And added statements about fish in the diet. I'm from Alberta, red meat capital of the world, 3rd largest exporter of beef in the world. This is an important table, and I don't know if you can see it. The intent of showing this slide is to tell you that macronutrients and micronutrients don't typically come by themselves. Hi, I'm a macronutrient. Eat me and I'm going to optimize yourself, because food contains macronutrients and micronutrients. Macronutrients and micronutrients do not live in isolation. They are part of the food products that we eat. And so if you look at the fruits and vegetables, clearly they're sources of carbohydrate, fiber, vitamins, and some minerals and electrolytes. Whole fruits, apples, oranges, bananas are high in potassium and low in sodium, for instance. Grain products, great sources of carbohydrate, fiber, B vitamins, folate, supplemented grain products, or what Des was talking about with respect to reduction in neural tube defects. Milk and alternatives, protein, fat, carbohydrate, calcium, vitamin D, magnesium. Meat and alternatives. Lean sources of meat, good sources of iron, good sources of protein, can be low fat, can be processed, can be a problem. So as health professionals, having a meaningful interaction with your patient who might have questions about food, you need to think about the food they're eating, and potentially a focus on macronutrients and micronutrients alone might render you slightly irrelevant. However, you need to be conversant in those topics. From Nutrition and Clinical Practice in 2010, nice paper that looked at diets, because frankly, we are all in search of the optimal diet. That creep at 49, it's relentless. You know, the weight's going up and intake changes. And if you look at a range of diets, from traditional diets, people who crunch grains up in little mortars and pestles had different goals. I'd like to talk a little bit about the SAD, standard American diet. The vegetarian diet is typically a diet that's high in fiber, low in fat. Macrobiotic diets have various components. And an anti-inflammatory diet, for instance, might be the Mediterranean diet. High in fruit and vegetables, low in meat, and high in appropriate fat sources. So since the 1950s, the standard American diet has had a lot of change. Increased consumption of grains, increased consumption of fats, increased consumption of sugars, fruits and vegetables, and increased total caloric intake. More recently, from 2011, a meta-analysis looked at grain consumption and risk of colon cancer. So once again, it's not only macronutrients and micronutrients, but what this shows is risk reduction of 10% incrementally for every increase in 10 grams of fiber. So although when the Canadian guidelines were published, the food guide in 2007, the evidence was less convincing, more increasingly as we acquire relevant data, there's more robust data to suggest that increased fiber intake helps. I have to speed up a little bit and talk faster. So let's talk about how we can change health in Canada. Digestive health is relevant, but if you look at this slide from Bruce Hollab, it projects that with respect to cardiovascular disease, cancer, diabetes, and arthritis, through dietary intervention, we could save on the order of billions of dollars, because these diseases are all amenable to nutrition amelioration. Let's just look specifically at this study that includes a consideration of macronutrients in weight loss. This was published in the New England Journal a couple of years ago, prospective randomized controlled trial. They did indirect calorimetry, determined everyone's energy requirements, and took away 750 calories. Then they provided counsel and group and established physical activity goals. So they changed the macronutrient composition. 52 years old, mostly female, BMI was 33, and their baseline dietary intake was about 2,000 calories. 80% completed the study. That tells you it was an unusual group for a dietary intervention. And this, once again, is complex, but the take-home messages is that this, this right here on the right, the empty diamond, is the Atkins diet, high fat, high pro. Weight Watchers is on the left, the filled-in triangle, 65% carbohydrate, low fat, low protein or moderate protein. They all lost the same amount of weight. They all kept the same amount of weight off. So these diets with energy restriction of 700 calories based on measured indirect calorimetry seem to work. What was the take-home message? Average weight loss, 3.6 kilos. Most of the weight loss occurred within 6 months. All diets reduced risk factors for cardiovascular disease and diabetes, and in fact satiety and hunger were similar for all diets. Positive predictive value for maintenance weight loss: do you attend sessions or support group function? So diets that are successful in causing weight loss can emphasize a range of fat, protein, and carbohydrate. And since this was a macronutrient talk, I thought it'd be relevant to identify that there are some studies that allow us to look at that. Let's switch gears a little bit, because I know I'm going to get the 5-minute window right away. Let's talk about micronutrients. Is this a food issue or is this a marketing issue? This is a slide from Jerzy Zawaskowski from British Columbia, who looks at functional foods. And if you look at this billion-dollar industry, you can see that vitamin supplements in the green here, minerals and meal supplements comprise a huge driving force. I'm sure you see that in your patient population. Patients are taking micronutrient supplements. A micronutrient that you might not think of as a micronutrient, sodium, deserves a lot of attention. Requirements, 1,500 milligrams, RDAs 2,400 milligrams, average intake 3,100 milligrams. Sodium restriction factors, limit processed packaged preserved foods. These are not skills, knowledge, or tools that health professionals consistently convey to patients. Where does the salt or sodium come from? Added while cooking, relatively low. Added while eating, not very common. Some from natural sources. 3/4 of it comes from eating processed, packaged, and preserved foods. Just as an example, plain pasta with sauce, 800 milligrams of sodium. In New England Journal in 2010, there was a provocative sounding board article that hypothesized disease reduction with sodium reduction strategies. So if all Americans, black and white, limited sodium intake to less than 2,500 milligrams, they postulated that there would be a reduction in blood pressure, cardiovascular risk, whether you're black or white, with a variable response to sodium restriction strategies by up to 20%. Powerful tools in our armamentarium for optimizing health. My last segue. As health professionals, we need to think of nutrition as a science. We need to be able to interpret it, and we need to consider macronutrients and micronutrients as part of diet, because you're going to get asked those questions. So what can we do as health professionals? Identify the type of research. Think of it as a study. Is it a lab study or an animal study? Is it a case control study? Is it a cohort study? Is it a randomized control trial, or is it a meta-analysis like that fiber story I told you? When you aggregate data on 1.9 million people with an incidence of colon cancer of 14,000, it allows you to make assessments and assumptions regarding risk. So deciphering media stories on diet, because they're always out there. The best studies are large and follow human participants over time. They balance the weight of evidence. Is it related? Is it possibly related? Probably related? An established relationship? Are the study endpoints clinically relevant? What was their dietary assessment methods? Some references, and I'm going to speed up here. Health Canada, Hassan, I just put that up for you. But my favorite site is the Harvard School of Public Health website. And I just updated this when I handed in my slides late a couple days ago. Current stories in the news. And in fact, when I looked at this in 2009, some of the stories are the same. What's the role of fructose sweetened beverages? What about potato starch? So the themes don't change much, but this is a great, credible resource, good for patients, good for health professionals. So if we interpret stories in the news, because you'll hear about this, you need to, as health professionals, think about the quality of the study and practice evidence-based medicine. Is it a large study? Is it about a human? Are the endpoints relevant? And have they used valid dietary assessment strategies? So nutrition is absolutely a science, and we can't think about it as just moms cooking or day-to-day people who have access to food without a prescription. We need to approach this with the same rigor. So in conclusion, macronutrients and micronutrients clearly have a major impact on health and illness. As health professionals, you need to understand the relationship between nutrients and food and dietary patterns. And if you do that, you may be able to harness the power. And you need to be able to think about nutrition as a science to be able better to provide resources, support, and counsel needed and expected by patients as it relates to macronutrients and micronutrients. Thanks. I'd be happy to take any questions if there were any. The question is, what is my take on replacing dairy milk with soy products? And you know what? There are tons of really good questions. So I'm going to put my science brain on and think, right, the big issue with milk, knowing that lactose intolerance is prevalent, 60 to 70% of the population, and it's such an important source of macronutrients and micronutrients, carbohydrate, protein, D, calcium, and phosphorus. We need to think about that. So I'm a believer in those alternate sources. So lactate, soy milk, great. We need to meet our nutrient requirements because osteoporosis is prevalent and it's a problem. And people don't drink milk. Average daily consumption of milk in Canada, less than 1.4 glasses, higher in Quebec. So it's important and relevant as health professionals to be able to have some answers that are often based on common sense but can be based on science. Des?
Yeah, I wonder if I could ask you about that thing that always troubles me, which is that public policies around nutrition seem to have huge effects, but personal decisions, even when we know what we should be eating, well, we don't seem to implement those. Where can we go with that? Do you think that we need to legislate everything, or we need to proceed on both fronts, or what?
I don't know. I was at a food health, an Alberta health meeting yesterday, and I think there's 13 food health policies in Alberta. I've never heard of a food health policy that influences the way I eat. So I don't think policy is the right way to support behavior change. As health professionals, I think we need to lead the way through knowledge and recognize smoke. Someone comes in and their weight's up 5 kilos, GP, and they come in with heartburn because they're going to their gastroenterologist. It is completely inappropriate to prescribe a proton pump inhibitor. You need to know that that person's weight's up by 5 kilos or BMI is up by 2 points and they're now 29.9. Your right intervention is to take a diet history, identify what their diet intake is and how that dietary intake, those dietary patterns, contribute to whatever problem you're seeing. I think that any interaction a patient has with the healthcare system is an opportunity to provide redirection. There's a ton of literature out there and it's all confusing. Look at all those nutrients. You guys should walk out of here thinking, blah, 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 blah. I'm really confused because there's a lot of nutrients and they cross over and they're integrated. So simplifying nutrition messages, focusing on important ones is relevant. The marketplace has another huge role to play. Don't know how to answer that question. Thank you.